Hello and welcome. You're watching India Fights Back with me, Rajat Kain. Well, in the wake of rising numbers of COVID-19 positive cases across the country, the government has announced vaccination session at workplaces, both in private and public organizations from April 11th. Now, as per the guidelines of this move aimed at widening the ambit of mass vaccination program, everyone aging 45 years and above will be allowed to opt for the jab. Well, the mass vaccination program in India is already been dubbed as world's largest inoculation program, and of course, as numbers are rising, there is a renewed push so as to have more vaccination. Vaccination is something that's the only shield we have besides, of course, the COVID appropriate behavior, which experts keep emphasizing on. So how will this move to help vaccination drive across the country counter the surge which is already locking more than a lakh cases in a day? To discuss further on this issue, we're joined with our guest, Dr. Rohit Sarin, former director, NITRD. Sir, many thanks for joining us, Dr. Sarin, and Dr. Rakesh Aggarwal, director, JIPMER, Puducherry. Many thanks, Dr. Aggarwal. Pleasure to have you on the show. Let me start with you, Dr. Sarin. Sir, what do you have to say of this government move so as to have more and more vaccination sessions, of course, which would till now confined to hospitals and dispensaries and health clinics, to now organizations, both public and private?
Well, I would say that it's a very welcome move. First of all, because it will further facilitate and enhance the vaccination program in the country. As we are all aware that, now it's close to 3 months, a little short of 3 months, and we have vaccinated about over 9 crore individuals in the country. However, this speed needs to be enhanced. You see, when we started the program, it was that we were working towards 30 crore population getting vaccinated. And I would say that in the initial phases, everyone was a bit apprehensive, including the medical fraternity, which vaccine to be taken and so on and so forth. But now all those things are ironed out, and I think we are clear on what vaccine to give. However, you see, still the vaccine uptake is not as it was expected. And probably one of the reasons was that people were finding it inconvenient to approach facilities which were, not closer to where they were staying. So to take care of this particular issue, the government of India has taken a very prudent step in organizing this vaccination program at workplace. And I would also say that, you see, today's experience with the vaccine has also indicated that the adverse drug reactions with this vaccine are not as was earlier expected. So we are more comfortable in taking these vaccines even at workplace. Earlier, if you recollect, that vaccination started only in larger hospitals, and even, you see, smaller nursing homes and all were not part of it. And then it spread to the private sector, and then it spread much lower down, you see, even to individual clinics where vaccinations were being offered. And today we are talking of vaccination being offered at workplace. I am definite that with this move, this will be another feather in the cap of the government and the vaccination program, because we will be able to reach that target figure that we are talking of in order to achieve some level of, herd immunity also, and the individual, of course, gets protected to a larger extent with the vaccination.
Right. Many thanks, Dr. Sarin. I'll come back to you. Dr. Aggarwal, sir, we know that this move certainly will also cut down on a lot of travel from, say, a certain set of people from the homes to hospitals, and now, of course, they can have the eligible ones and given the organization structure within their offices as well. So given this surge that we have seen, especially in the month of March, how important does it get now to enhance or to spread tentacles of our vaccination program? Dr. Aggarwal?
So, the whole aim of the vaccination program is to immunize as many people who are at a high risk of serious disease as
Mm-hmm.
possible and as rapidly as possible. Surely, there are limitations in how many we can vaccinate in a day. So, but whatever we can do, we should try and do. And that is exactly what this is doing. This would, in addition to what Dr. Sarin said, we are taking it to their workplace. So that is a
Mm-hmm.
place they are familiar with. They don't have to travel. Their employer is on board with us. Also, it helps when people are in the company of people who they work with. There is
Right.
a kind of feedback loop. You see three of your colleagues walking down for immunization, then you also feel confident and you would also feel encouraged to go and take the vaccine. So, in
Hmm.
that sense, also it should help. Also, many of these offices and organizations actually have their own medical unit, and those units have been integrated into the planning of this program. They are the people, they are the healthcare staff that people in a large organization are familiar with. They have greater confidence in them, and therefore, even that should help. So, I think it really fits in with the policy, a graded policy of expansion. Initially,
Mm-hmm.
we covered people at the highest risk of disease, people who were closest to the healthcare organizations where care could be taken. So, the healthcare workers were immunized. Then we went to the elderly and we opened it to some more clinics. And
Mm-hmm.
finally, we are moving further into the field. So I think it's a part of the design. That's how it was planned that we will go gradually expand, and this is a part of the expansion as it should happen. The natural consequence, natural way the event should progress.
Right, right, right. So thanks. Dr. Sarin, do you feel that now the vaccination should perhaps be open to other sections of age as well? Of course, there is a clamor, there is there is a thought process that given the surge in cases, especially in last couple of weeks, or to say in the month of March, there is need to vaccinate even youngsters. So do you see that very soon, possibly we might get decision on this? I know it's totally in the administrative ambit, but as an expert on the hypothesis of need to vaccinate more and more people, what's your take on that?
I think it's very clear that vaccination will be required for each and every individual in society. I mean,
Mm-hmm.
there is no doubt about it. However, you see, prioritization needed to be done in the very initial phases because those who were dying as a consequence of this infection had to be tackled first. And
Right.
in that context, to reduce mortality, it was, you see, to those who were overtly exposed, that means the healthcare providers and then the frontline workers, because these
Mm-hmm.
come in contact more with public and society and are at greater risk of developing the infection and subsequently suffering from it in terms of morbidity and mortality. And then the government approached those who were 60 years plus because the elderly are again at a higher risk of you see, dying as a consequence of disease as compared to the younger population. And so was the case with those who were 45 years plus with some sort of comorbidity, that is, some sort of other lung disease, heart disease, kidney disease, liver disease, who again were at a greater risk of dying as a consequence of this infection. Therefore, the prioritization was done. And as and when we gained experience with this, the expansion further increased. You see, then
Hmm.
45 years, even without comorbidities. And I'm
Right.
sure in due course of time, it will be, you see, all adults and then maybe even children. There are studies which are
Mm-hmm.
going on to see the safety of this vaccine in children. And initial results are very encouraging. So I am sure that as we have seen in the United States of America, that all adults above 18 years of age are eligible for vaccination, that scenario will also come into India. So
Right. Right.
I would say the only limiting factor in all these is the capability or the capacity of the health system to take care of the vaccination availability and distribution, and of course, you see, to approach the larger groups which will be there. So the vaccination sites, which today are close to around 38,000, 40,000, they may further have to be increased and I think this particular step of vaccination at workplace will also give us more encouragement once we see it through, that we can have sites even other than recognized health facilities as vaccination sites, and that will, I think, further push the vaccination program to the larger population that is below 45 years also.
Right, right. So here we have Dr. Sarin emphasizing on the need to push, of course, like vaccination program, and possibly in days to come, we might see this getting expanded. Dr. Aggarwal, let me broad-based discussion here, sir. In last week, we have seen there have been a couple of studies, one by experts from IIT and IISc about, say, the ebb and flow of this particular second wave, that it'll reach its peak in April and slowly then numbers will start coming down. At the same time, there was also a study by the ICMR in terms of reinfection. All the sample was small and number of reinfection cases were fairly small from the sample even. So juxtaposing these studies, and of course, like as we have seen rising numbers, so how important do you feel there is a need to vaccinate or at least pay attention to the younger population here?
As I look at all this, I think we really are still, not only in India, but in most part of the world, at a stage where our emphasis should be on preventing deaths, preventing serious illness, preventing ICU admissions, making sure that our hospitals remain open. We have facilities for ventilators and ICU for those who need it. Therefore, as of now, we and countries such as us need to focus on high-risk groups, those who are at a risk of serious disease and mortality.
Right. Okay.
That is how our focus will have to remain for substantial period of time, at least during the second wave. We, I don't think, are at a stage where we have to think in terms of cutting down transmission or reducing transmission. That's not the stage our country or many other countries such as ours are. We have to focus on reducing mortality, reducing serious illnesses. Also, remember that the modeling studies have a role, so they do have a role. However, a lot of imponderables come in because modeling studies depend on what parameters we assume. For this virus, those parameters are constantly changing. We don't have information on them. We do not know how long the protection from natural infection lasts, how long the protection from vaccination will last. We have variants coming in. We have uncertainties about what proportion of infections are by variants and the characteristics of variants as compared to the wild virus. So I think we'll have to play it by the year as things go on. We will have to change our strategy as situation arises, and that's exactly what we are doing as a country. Deciding on something and then sticking to it without blindly would not do.
So as a virologist, Dr. Aggarwal, I have one question to ask to you here, sir. Whenever we talk to the variants, when the cases of variants started coming in January, or to say the end of December, there was always this debate whether the severity is correlational to say the extent of spread. Now we have seen the extent of spread in second wave, which certainly is higher than the first wave, or to say last year what we saw the scenario was from March to November essentially. Given the surge here, how important does it now get to actually to understand the nature of the virus, especially mutants here? Like, how much of a mutants would be contributing factor in the ebb and flow of numbers now?
It is very difficult, Mr. Rajat, to be sure.
Right.
We have multiple things. Last year, at this time of the year, we had lockdowns. We had no travel. We had people limited to homes. We had everybody was much more worried about it. People were using measures very strongly. Even if a variant does not cause a more frequent infection, just because people are not following the measures very strongly, there would be an increased transmission. So it becomes very difficult to separate the effects of these things. We know we can just need to look out of our window and we can see how people's behavior has changed. And I would think that a large part of it could be related to just change of behavior compared to last year rather than to variants. But then variants could also be playing a role. Most likely, it's an interplay of both. But in different places in the country, the role of each could be very different.
Right, right. Many thanks, Dr. Aggarwal. This is really important. Dr. Sarin, like we have seen, of course, let's admit that there has been some complacency among people. There have been cases of people not following COVID appropriate behavior. And of course, like things are certainly different than what it were last year, as Dr. Aggarwal rightly said. People were in a different frame of mind. They were following all those protocols extremely, carefully and with strict routine. Now things have changed. There is a clamor to get back to normal. I mean, places have opened, schools have opened, restaurants have opened. There are certain restrictions now on. How does one balance it out? Like the life has to go on. And of course, as we keep hearing from experts as well, I mean, some, or at least by ministers, that somewhere we have to, you have to start living with the presence of virus. So how do we balance it out?
I think it's very clear that here again, the COVID appropriate behavior is something that we will have to have as part of our lifestyle. And until and unless we do that, because the virus is going to remain here, it's not going to go away. We are not, that fortunate that organisms leave the country or leave the world. Organisms are there, they'll continue to be there. And to survive, they may mutate and things will happen. So we, as a species, have to be careful that, yes, what all is required to protect ourselves from the organism. And I would say that as on date, the only two things that we have very clear cut are the COVID appropriate behavior and the vaccines, right? These are the only currently available tools with us. And we have to stress time and again that COVID appropriate behavior, that is covering your face, the mask, washing your hands properly, and of course, keeping a safe distance, that one will have to, really work towards emphasizing at all steps, at all age groups, children or adults, and so on and so forth. Regarding vaccination, yes, as on date, definitely the priority is to reduce mortality and morbidity, but in due course, it will go down. Once we have achieved that, then it will definitely go down to the lower ages. The question is that we have to balance on in terms of economic impact of this illness also. And I think that is the reason why lockdowns and all will really not be the answer. They may, in the very beginning last year, we had to resort to them because we really did not understand too much of this particular virus. And, we were very apprehensive and scared as to what would be the outcome. But today we understand it a bit better. And I would say that even though the virus has mutated, still we are comfortable with not having total lockdowns for periods which affect economy. We can just insist on a COVID appropriate behavior, and maybe certain steps like have been taken in Maharashtra, in Delhi, and in some other states, to restrict movement, to work from home, things like that. So those will also help. But as you rightly said, Rajat, work has to go on. Work cannot come to a standstill because livelihoods are dependent, lives are dependent on the work. So one will have to strike a balance, and that is the way forward.
Right, certainly there is a need to strike a balance in life, but at the same time, our experts keep emphasizing that please adopt and, of course, follow COVID appropriate behavior because this virus is here to stay, unfortunately, for us. But all we have to do is to follow these basic protocols. Dr. Aggarwal, as we near the close of the show, coming back to our, say, the basic point on which this show is emphasizing upon the vaccination at the workplace. Sir, there have been some reports, of course, there have counter reports as well in terms of shortage of vaccine at certain places. So now, with the widening of the ambit of vaccines, I mean, how do we see it as a challenge, as an opportunity, so as to have more and more vaccination? Or in terms of challenge, will there be a scenario of a shortage of vaccines at a designated health places? How does that needs to be covered up?
See, people who are managing the program are extremely competent. They are
Right.
extremely engaged. They are looking at everything round the clock. I think as a country, as citizens, we have to have faith in their judgment and let them manage it as best as possible. When you are dealing with a commodity which is just being produced and don't have stores of it, and we have to manage with it, they have to see how best to do it. And I can assure you, I have interaction with many of those people on a regular basis. They are doing as best as is possible. They
Right.
will make sure that we have the vaccine available as far as possible at most places. Occasional places where there are stockouts in a country as huge as ours. Remember, we are 1/6 of humanity. Okay, so some things will happen, but I think we need to take them in our stride. That's a part of our daily life, and we need to learn this, and we don't have to get into it too much. That's how I would like to cover it.
Right, right. Thank you, Dr. Aggarwal. Dr. Sarin, your take with some reports of, say, shortage of vaccination in certain places, and now with the widening of the ambit of vaccination, hopefully that these problems will not recur at the workplaces, or for that matter, whichever places there are more vaccinations?
Well, I think that, you see, as Professor Aggarwal has stated, that the country is fully aware of the situation. These states are also aware. The administrators within the states are also aware. And whatever, gaps are there, they are being addressed. But you see, this huge country, it's really a subcontinent, I would put it. These things are bound to happen, not only with vaccines, because we have to also strike a balance between availability and wastage, because if you make too much of it available at any particular site, the chance of its wastage also is higher. So
Okay.
therefore there has to be a balance, that okay, at a particular site, and how many can be vaccinated, what is safe, and therefore the quantity of vaccine provided to that site is also determined in that manner. But yes, the manufacturers are also being pushed into enhancing their manufacturing capacity. They are linking up with other colleagues in their own field to see if manufacturing sites could be expanded and go beyond
Right.
what we have today. And exports of this vaccine have also been cut down, so that the vaccine could as such be available more for our population first, and only subsequently. I mean, I was reading, one of the manufacturers very clearly stated that yes, for the next couple of months, the produce will be primarily for India, and exports will be markedly reduced. So I think these are the steps which manufacturers are also taking, which our policymakers are also taking.
Right.
And I'm sure these smaller hiccups and things will be taken care of. I mean, that is
Right. Absolutely. Right, sir. Right, right. Dr. Sarin, for joining us and, of course, elucidating on the extremely important aspect of widening the ambit of vaccination. Dr. Rakesh Aggarwal, pleasure to have you on the show as always. So, gentlemen, that's all we have in this edition of the show. But before we leave, there's a small appeal to all our viewers. Please keep following COVID-appropriate behavior, keep wearing a face mask, do not forget to maintain social distancing, and keep washing your hands. Remember, these are small things that can help us in defeating the pandemic. Well, that's it in this edition of IFB. Thank you. Goodbye.